Does your first scan show twin babies, but the second scan is showing that you are having a single baby? This is known as vanishing twin. If you want to learn about this, join me from the beginning to the end of this video to learn all you should know about vanishing twins. Stay tuned. If this is your first time of seeing this post, click on the plus sign to follow, like this video, share this video to your family and friends, comment on this video, subscribe for 247 medical consult. Vanishing twin syndrome, also known as fetal reabsorption or disappearing twins syndrome, is a phenomenon that occurs during pregnancy when one of the set of the twins spontaneously miscarries or absorbed by the mother's body early. In this situation, the woman had a miscarriage of one of the twins, but she did not know. So in this video, I'll be telling you all you should know about this. What are the causes of this vanishing twin syndrome? There is no exact cause for this vanishing twin syndrome. There are so many things that can cause it. The first thing that can cause this vanishing twin syndrome is chromosomal abnormality. When there is problem with the chromosomes that form the baby, that that is when such things happen. When there is developmental issues, it can result to that. Implantation difficulties or problem with the placenta. So when there is problem with the placenta, that maybe the second twin did not implant very well, this can lead to vanishing twins. In some cases, the embryo might fail to develop when you have seen it on the scan that you're having twin baby, and at the long run the baby refuses to develop. That is when this vanishing twin syndrome can occur. So what are the diagnoses? Vanishing twin syndrome is often diagnosed during the early prenatal ultrasound scan, typically performed in the first trimester. Initially, you have two gestational sacs and embryos may be detected, but subsequent ultrasound will reveal that you are having only one embryo still developing. So that is why it is known as vanishing twins. You have a twin pregnancy sac earlier, but later on you are having one pregnancy. So this is indicating that there has been a miscarriage and you might not know. So what are the signs and symptoms that you should look out for in vanishing twin syndrome? Maybe you are having a twin pregnancy now. You should monitor yourself of these signs to know when you are miscarriage is occurring, or you are going to miscarry one of the twins. Then some women may experience mild vaginal bleeding or cramping in the early pregnancy, which could be attributed to passing of the vanishing twin. So as a pregnant woman with twins, you suddenly have a bleeding that occur. Maybe you did not go to the hospital to check yourself. Subsequently, the body will absorb that and the other baby will continue growing without knowing that one of the baby has died. So in some cases, the surviving twin may show a sign of growth restriction. So the remaining baby might show a sign of growth restriction. Then, depending on the timing and circumstances of the fetal dismiss, maybe if the babies are not implanted very well or it is caused by placental problems, you will see that the other baby will react. So how can this vanishing twin syndrome affect you as the mother and affect you as the parent? It has an emotional impact. Experiencing vanishing twin syndrome can evoke a range of emotions for the expectant parents. Imagine that you went for the first scan, they told you are having twins, and your heart is filled with joy. Then later on, you are having a single baby. It will bring grief, confusion, and guilt, and really, so that maybe people, your husband will say, "That's why you are not resting." The wife will say, "I'm resting." All those kind of things. It will bring about disunity in the family. Then counseling and support is very helpful for individuals with that lose one of their twin to regain their strength. So what are the risk factors? What can predispose you to having a vanishing twin? that is one of your twin to disappear during pregnancy. The first one is advanced maternal age. When a woman is above 35, you know her hormones are down, maybe the progesterone cannot help the pregnancy, is not more sufficient enough to carry the pregnancy. This can result to vanishing twin. Then assisted reproductive technology, that is IVF, and certain medical conditions that affect pregnancy, such as uterine abnormality. When you have uterine abnormality or clotting disorders, it can lead for one of your twin to die in utero without you even knowing. Then the next thing is that I'll discuss is how do you manage this condition? So, what are the things to look out for while managing this condition? So, in most cases, vanishing twin syndrome does not pose any significant health risk to the surviving twins and the mother. I said that some women will even have the miscarriage without them even knowing. You get, on their second scan, they'll now see that the baby is only one, that the body has absorbed the other one. This normally occurs in the first trimester when the baby has not evenly formed, maybe in the form of a embryonic sac. So at that stage, it will die off and resolve. So it does not have necessarily have any impact to the mother. So additional ultrasound or prenatal tests may be performed to assess fetal growth. So once this thing have happened, what you know is what you should do is to go for ultrasound to check whether the other twin is still growing well. If not, they will maybe the doctors will prescribe a medication that can help you build up your hormone to help the baby. So expectant parents may also receive emotional and support counseling due to you have a bad feeling about yourself now. So when you have gone for the first scan and they are telling you that you are having twins, then the second scan is saying that the twins is no longer there. So it can cause so many emotional chaos. So that is all about this vanishing twin. So anything, if you're having any of the symptoms I have mentioned, or you are pregnant with twins and suddenly you see bleeding, please go to the hospital ASAP and always consult your doctor. Complain whatever concern you may have during your prenatal visit. So thank you for watching today's video. If you find today's video interesting, click on the plus sign to follow, like this video, comment on this video, and share to your loved one. And see you in my next